Hello, 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 friends and family. Happy Sunday. It is 5 o'clock Eastern Standard Time here in Maryland. This is Sharon Herbert, Power RN, inviting you to Power Time. We're coming to you live from Power in Nursing Innovations. Another beautiful Sunday here in the beautiful state of Maryland. And happy Mother's Day to all the beautiful mothers. We love you, we love you, we love you. And we're so glad to come your way on this Sunday. It is a beautiful day once again. And we are so happy to be able to spend time with you today. So, I just want to say one of the funniest things that has happened, and it's not really funny as in ha ha funny, but that I've had an opportunity to kind of have some time with the man above, And he's given me something to share with you. Now, if you've had a chance to look at my bio or read anything I've posted about why I'm here and what I'm doing, you know that I'm a registered nurse who's been a registered nurse for, as I might always say, 100 years. But there have been so many experiences that I've had and so many people that I've worked with and touched and loved, and some of us are still together. I sometimes get a chance to connect with some of the new grads from the classes of 21 and 22. So I'm looking forward to also getting to connect with the class of 2023. But a lot of things have changed over the course of the last few years in healthcare and in nursing. Nursing has been more like a battle for nurses. The work that we do continues to be needed for the community, but the burden from the existence of COVID and the spread of the pandemic has been wearing nurses out and wearing them down. Now, I think 2 days ago or so, we have had the CDC acknowledge that the pandemic is over. The pandemic is over. But in the course of that time, nursing has been a place and space that has been very stressful for nurses. Imagine, imagine that we have suffered through the pandemic as well as taking care of patients. There have been more patients and more patients and sicker patients and chronically ill patients. The stressors of physical, mental, spiritual, and emotional challenges has taken hold of so many nurses' lives. We have been stressed, overworked, overwrought, and I'd say overwhelmed. What can we do different to make nursing a priority for the healthcare system and a priority for each and every nurse? We have got to take care of ourselves. The stressors of the workplace, work-life imbalance, workplace violence have been devastating to nurses, and we need to make a change. What can we do differently? can we reimagine health and wellness? Can we reimagine nursing? Why is it today, and still today, that we nurses and nursing are under the control of a system that challenges what nursing do, what nursing is, and is promoting and providing a disease-based model for the healthcare system? Now, once upon a time, maybe you don't remember, but I do. We learned in nursing school about health and wellness. And here we are today fighting diseases. What happened to public health? What happened to community health? Today, we can hardly imagine what can and will happen the next day and what has happened yesterday. You dread going to work, and you dread even going to church, to the hospital, to school, because you can be in danger. Your family members can be in danger. Your kids just going to school. The shoutings and the shootings. This is insanity. This is insanity, people. This is not what we imagined we would be doing once we passed our NCLEX and got our license and got a job in a health care environment. Where is the health and where is the wellness? We are fighting chronic illnesses, pandemic, the environment of our communities, where their health disparities, you can pinpoint them on a map, the neighborhoods and the communities that will have the sickest people with the least support, the least access to health care, the least access to fresh foods, the least access to jobs, the least access to educational offerings. That's where we are today. How can we reimagine our work that we love to be a place and space where we are sharing and promoting health and wellness? Reimagine your life in promoting health and wellness and helping people be healthy and well. What happened to community health? What happened to public health? In the pandemic, who was going from community to community, from street to street, from school to school, church to church, sharing the good news about promoting well-placed access to health care services? Well-placed access. No, we've let those communities without good access just continue to sit there. Rural communities. I just read another article about a woman who died in Alabama because their closest community hospital closed down, and her family, they called for an ambulance, but they couldn't get one in a timely manner, so they chose to drive their loved one in Alabama from a rural community to the closest hospital that was 30 miles away. This woman had a heart attack and died. Can you reimagine having health and wellness as a focus in every community? Folks will know what to do, how long to sleep, what to eat, when to exercise. We talk about diet and exercise. We're not talking about being on a diet. We're talking about a healthy diet. Reimagine that folks come to ask you questions that make sense in the plan that they've already started for their own health and wellness. They just need some confirmation. Can we imagine long walks in the park, smiling as you go on your trip to the grocery store to fill your picnic basket? You're going to take a nice lunch with your family or your loved ones. We can reimagine health care and the service that nurses provide. We all know what we were taught in school, and it wasn't how to fight the pandemic. We talked about and did our studies about health and wellness, the patient's community health and wellness, and we have to be well ourselves before we can serve. As they tell you on that airplane, what did they tell you? Put your oxygen mask on first. It is so that you are able to help someone else. You can't help someone else if you're not well yourself. You know, nursing can change the world of health and wellness. We can change the world together. We have to come to consensus, and even in collaboration with other health care entities, whether we're talking about physical wellness and physical therapists, occupational therapists, social workers. We can do these things that promote health and wellness. Reimagine transforming health care so there is a wellness focus and that folks just don't stay sick at home and in their communities and only look to find their primary care provider if they are in a place and space where their illness has overtaken them and they don't know what to do. We need to increase our reach to the community. And you know what? If ICUs aren't overflowing with people who are coming with whatever's going on now, even whether it's a heart attack, it's something based on, most likely, chronic illnesses, things that have not been taken care of. They come with a heart attack, but they're obese. They come with a heart attack, but they have diabetes. They come with a heart attack. Oh, there's something else going on. They have gout. They've had a stroke. And now they have COVID. We need to help those communities and the folks in the communities be in a place and space where they are able to collaborate and make places and spaces and train people that can help each other. And there's more to come. If nurses ran health and wellness and healthcare organizations, we can change. We can change the focus on disease, because that's what people see. Disease, and that makes you have to come to the hospital. That means you're in an ambulance, which is going to keep those folks from serving other people. You're going across town. Because now you haven't taken your insulin and done what you need to do, tied up this ambulance so it's not available to help someone who's having a heart attack. Do what we need to do and let's train each other. There are folks in your community, even if you don't have a hospital, most likely you have a fire station. Those folks can help respond to some of your questions as well. If you'll ask them, should you see your doctor? They will always and most likely tell you yes. If you have a question for your doctor, go see your doctor. And in the meantime, we shall have some input from the members of our community. If these are places and spaces where there aren't healthy foods and there's no access to health care providers, whether community or public health settings, let's have these communities come forth, whether it's in a church or in a school. Let's find what we can do to help folks in the communities be healthy and well. And it will give us a chance to collect data as well and find out what's going in the community, what's going on that's not working. And you can work with your community uh, board, and or you can work with your city or state entities to find out how we can make life better in the communities and promote and facilitate health and wellness. And I know I talked a lot today, but remember, you can you can you can find Power RN on social media. We need to get each and every nurse to consider reimagining healthcare and reimagining nursing in the health and wellness spectrum. This will also be so beneficial for nurses. We're talking about staffing shortage, which is nothing new. But the more and the sicker patients are in the community puts more work on nurses. Those are patients now that you have to lift. Then there's not one, there's two or three, and now they're in the hallway. They've crowded up the ICU. There are no more beds because there are no more nurses. And we don't want to have to go through the struggle and stress every day of having 2 or 3 or 4 or 5 patients in the ICU on the ventilator because of the chronic illnesses that are getting worse and worse. It's a benefit for them to be well, and it's a benefit for you to be in places and spaces where you can help them be better and live longer. That's my story. Reimagine nursing. Reimagine health and wellness. We know that we were taught some tasks in school because every now and again someone will ask you if they need a Band-Aid for this wound, and when you look at the gaping hole, you will tell them to go to the hospital. Cleaning is good. Washing of hands is good. So these are the things that don't cause us to have to lift heavy patients. We'll continue to be in places and spaces where people can ask questions and get answers that can save lives. Thank you, thank you, thank you for joining us today at PowerTime. Remember, reimagine nursing. Nurses are transforming health and healthcare in your community. Listen out for nurses transforming health. We can do it. We can do it together. and the world will be so much better for each and every one of us working together. Happy Sunday and happy Mother's Day to all the wonderful mothers all over the world. Be well, and we'll see you next time. It's Sharon Herbert at Power Time. The Power RN is here for you. Be well, my friends. Be well.